Welcome to the Optimove podcast, and if you've listened to us before, welcome back. Today's episode is an interview with Jeffrey Guild on how a mobile practice got started and how it addresses the frustrations people are facing currently in healthcare. We'll pick the interview up when I ask him why he chose to make Optimove a mobile practice.
Yeah, a lot of it was filling a gap that I saw that people are facing in healthcare. When people leave out of the hospital or skilled nursing facilities or wherever it might be, and they return home, a big responsibility of the healthcare provider is to make sure that the person returns home safely. And what I was seeing was that, of course, people were being pushed out of the hospital and pushed out of skilled nursing sooner. And then people were being released less and less safely because there was less planning, there was less time, there was less ability to really make sure that people were able to get back to their home environment as safely as possible. On top of that, home health has been getting a lot of cuts from insurance companies, from Medicare, and as a result, the home health companies and home health healthcare providers are not allowed to spend as much time with their patients as they would choose to if it was up to them. And so people are not getting the type of quality of care as they should be when they're returning home. And so what I was seeing was it did not matter the situation that the person was in. It didn't matter their medical complexity. It did not matter their age. It didn't matter even what resources they had. Everybody was being sent home in the same way, and that way was not as good as it should be. There needed to be another option for people to be able to have a service that joins them in their home and then can guide them based on their needs, their desires, their wants, and what they want to get back to doing in their life. And with an approach that is much more individualized and with the amount of time and care and attention that is needed when people return home. Because the other option is, and too often people end up back in the hospital. And of course, then the hospital system gets dinged, the skilled nursing facility gets dinged for it. And then the worst thing of all is you have the person who is back in the hospital. And so then they're back on that downward spiral of declining physically and medically and the quality of their life. So that it was filling that gap that I was seeing as a healthcare provider.
Okay, so it sounds like basically the bulk of what you're doing is just about offering people another choice, making sure they have another choice. Absolutely.
And, there is a purpose to home health. There's a purpose to big hospital systems. There's a purpose to outpatient rehab facilities. And they often do a great job given the circumstances that they're set up in. But there needs to be other options, other choices that people can go to based on their individual situation. So for instance, with outpatient physical therapy clinics, which is a great place for people to go to after they come out of the hospital, after they go to a skilled nursing facility. And as a healthcare provider, it was usually, if I can get them to outpatient, that would be where I'd want them to go, because that's usually where they're going to get the most care and the highest quality care that I can try to get them. And especially for our patients who were more medically complex, older, they oftentimes had specific neurological diagnoses. A large hospital system with the outpatient neurological rehab practice was the place for them to go. The challenge, of course, is a lot of times there's transportation issues, there's timing issues, there's energy issues with the population that we serve. And so it can be very difficult for people to get into a large hospital system on a regular basis, or there might be a waiting period trying to get into a large hospital system from the time they call to try to make their first appointment. By the time they can get evaluated, they might have to wait a month or two before they can get in. Just the basics of traveling, the energy it takes. And this is an ideal situation because you don't often find a four-walled, rehab practice in a strip mall that focuses on neurological disorders, medical complexity, things like this, right? Those sorts of things usually exist in large hospital systems. And even if you had that, there's still transportation issues. And we would see that when I was working, I had the fortunate opportunity to work in an environment where it was a traditional outpatient orthopedic practice. And we were basically working on expanding the vestibular and neurological aspect of that practice. And basically what was happening was people loved the ability to just pull up to the four-walled clinic and be able to walk in the door. And it was a major advantage that they would not get if they had to go to a large hospital system, because the maze of the place oftentimes, and parking and everything else and figuring all this stuff out. And if you're over the age of whatever, and if you have whatever neurological diagnosis and you have all these things going on, that can be very challenging. But even with that perfect situation where you could pull right up to a four-wall clinic and walk in the door, you still have the problem of if it rained or if anything happened, about 90% of our patients would cancel that day. And so people weren't getting the treatment and care that they needed. And then, of course, if it rains every day, then you're having a large percentage of people not getting the treatment that they needed. Or if they fall and become bedbound, or something happens and they become bedbound. As a healthcare provider, then you're left in the clinic kind of feeling helpless because you're not able to help that person in a situation where they actually need you the most. And with a mobile model, we're able to get to that person. If something happens, they're not doing well, they're not able to get around safely anymore, they become bedbound all of a sudden, we're able to get to them and manage them in their home in real time, facing the current situation that they're in, and we can get to them quickly. We don't have to wait until the next appointment time. We can get to them as soon as sometimes the same day, whether it's the next day, but we can get to them very, very quickly. And for that reason, we can work with people in their environments if they experience that type of a decline. So for all these different reasons, there was a major benefit of providing a mobile option for people where they didn't have that option before.
In every other industry currently, people are getting kind of the ability to have things more customized for them based on their needs and wants and desires, but that doesn't seem to be happening in healthcare. Is that correct?
Yeah, it's a great point. So, I guess we're not that far away from a drone showing up at our doorstep and dropping a box, and we're mad because it didn't arrive in 10 minutes, so we're approaching that, right? Any option in fitness that you want, like it's pretty much there, so there's lots of options for people. What was happening in healthcare is because of the increased red tape, because of the increased bureaucracy, healthcare providers were being forced to act more like bureaucrats than healthcare providers. And of course, that's not natural. And so you would see that decline to the patient and the quality of care that they would receive. You would see that people are spending less and less time with their healthcare providers. They were being kicked out of the hospital or skilled nursing more quickly. And the healthcare provider is spending just more and more time with their head buried in front of the computer, just trying to check all their boxes that is required of them. And even to the point of, someone else standing outside the door, tapping their foot, shooing the doctor along. It's like, okay, on to the next person. And it's not even the healthcare company's fault. It's just the reality that from the top down, everything was becoming more bureaucratic, more red tape. And so the only way to really have a standalone independent clinic, whether you're a physician, a physical therapist, no matter who you were, was to get out of that traditional model. Because what was happening is basically the large hospital systems and large healthcare companies were basically eating up all the independent practices, because the independent practices couldn't keep up with all the red tape in the traditional model. And so that was what we were seeing. So now you're only dealing with healthcare providers that are associated with a large, healthcare company or a large hospital system. The benefit is now the pendulum is swinging the other way now. And so now what we're seeing is healthcare providers getting creative, going into different models of care. So of course you have concierge doctors now, you have direct pay doctors, you have co-op, health insurance options. There's all sorts of different types of options for people now that if you look for it, it's there and it's quickly evolving. And so healthcare providers are saying, no, I didn't go into this to function like a bureaucrat or to just spend 5 minutes with a patient. I got into this to be able to help people, and they're responding accordingly. And so that's the exciting part right now in healthcare is you're seeing a lot of different options for people. And so all we're doing is being one one practice, one company that's serving people in a different way to provide options for them. So that way it's customized for the individual based on what they want, what their needs are, based on their individual situation. So what was happening before, it'd be a lot like if every single fitness center was just a YMCA or a local gym funded by the city, right? Nothing wrong with those sorts of things, but sometimes people want something different. Sometimes they want a personal trainer that might be able to go a lot more in depth and be a lot more involved and a lot more individualized, and someone that, kind of more of a boutique, right? Some people want that. Or sometimes you want more of a specialty yoga situation, or you want specialty Pilates, or whatever the case may be. In healthcare, a lot of different options are being created for people now. And I think that's a positive thing that's happening.
So on the topic of living a long life, or living a better quality of life in the latter years of it, there are a lot of people who really aim at kind of making that happen for themselves. And it's an incredibly high maintenance lifestyle that involves a lot of medication, a lot of pills, and a lot of keeping up to date with the latest kind of research and that type of thing. Is there any evidence that that type of thing works?
Yeah. And on the same token, we do run into the occasional, say, 85, 90-year-old who takes very few medications. So that's always a possibility. So we've done a great job at keeping people alive longer, and you'll hear this all the time. So that's not new. So the challenge is, how do we keep their quality of life up? Now, fortunately, I think what we're seeing is, 70 is the new 50, or whatever you want to call it, 60 is the new 40. And so that's fortunate, especially since I'm coming up on 40 years old. It's, the fortunate part is there's a lot of things in our daily lives that have made a lot of progress in the past few decades. Of course, smoking has dramatically gone down. I believe our eating is actually now pivoted as well. Companies have gotten the idea that, if we put actually less ingredients in here and we put real ingredients in here, then people actually buy it. So that's a positive thing on the eating and the nutrition front. We found out that sugar was actually causing a lot of the issues, and it wasn't the fat. So the low fat craze from the 90s is hopefully done away with completely by now. And of course, processed foods make people older and older, and we see that all the time in healthcare. Basically, heart disease, liver disease, and this downward spiral from all these negative things. So, of course, this the food that we eat, and it's the exercising that we do. So it's becoming more and more common for people to exercise as part of their life. So that's the other positive from all this. Now, on the healthcare end of things, it's true. So you have, Social Security starting in, 1935, and assumed that people were going to live to a certain age and would take care of you for the last, 2 or 3 years of your life. Medicare was, I think it was 1965, give or take. And the life expectancy at that point was about 68 years old. Well, now it's increased 8 or 10 years since then. And for better or for worse, we have not adjusted for that. We haven't increased the Medicare age. We haven't done a whole, for better or for worse, leaving politics aside. And the last thing we need is more politics right now, of course. But, whatever you think about what should be done, the reality is the age hasn't changed. The Medicare age hasn't changed. We're living longer. So put simply, there's a big mismatch between what's happened with life expectancy, with quality of life since these rules were originally created versus the way things are now. And for better or for worse, we haven't adjusted for that. And so we have to get creative, both as a society, but also as healthcare providers, to provide solutions for that. And so what we need to be able to do is find a way to, yes, we need to have people live a longer, higher quality of life. Great progress has been made in surgeries and in medical and in everything else, in fitness, and hopefully more people are catching on with the eating and the fitness. But at the same time, we need to empower people to be able to remain active and independent out in the community and in their home for longer. Because as soon as they end up in the hospital and then stay there, or go into the hospital system and then go to skilled nursing or assisted living, then of course the the healthcare costs dramatically increase, the quality of life dramatically decreases. And so the best thing we can do as a society is find ways to keep people active and independent in their homes, stay out of nursing homes, stay out of hospitals as much as we can. So there's a lot of intervention that we can provide as healthcare providers on the front end. So spotting falls before they happen, making the home environment more safe, and back to the purpose of the mobile service. So we're able to empower people to stay in their home as long as possible, and then we can prevent them from going to the hospital because we're able to get to them very quickly and to be able to provide the solutions that they need in the moment, in real time, and to prevent that downward spiral from happening. Because once they go to the hospital or they have that hip fracture, then the downward spiral happens, and then the quality of life decreases, the healthcare costs increase, and then it's a larger hole to dig out of from there. And so what we want to do is to act proactively and prevent that hole from occurring. And the other fortunate part is we're seeing more and more people think that way now. So they're acting more proactively. And as soon as they're beginning to experience a balance problem, or they're beginning to experience dizziness, or they're not accepting it as much as this just comes with age. Of course, too many people still are, but we're also seeing a lot of people that are not accepting it. And so they're acting more proactively. And so we as healthcare providers need to be able to be there for them when they want to act proactively as well. And so it's not just helping people once they are in a big hole. It's also getting to them and being there for them when they're ready to prevent that hole from being dug in the first place.
So you've described a ton of tremendous benefits to mobile healthcare, but are there any downsides to mobile healthcare?
Based on what we're seeing day to day with our clients from our clinical experience, and even the evidence supports that, as far as being safe in their home and promoting safety in the home and preventing falls, there's not a downside to a mobile service, because the main differentiator is that clinical guidance that focus on that one-on-one care, and the direction of the healthcare provider, the skill of the healthcare provider, along with the collaboration with their patient or client that they're focused on. And of course, the patient or client being adherent with the recommendations. And so the main takeaway is you don't need a lot of fancy equipment or all this extra, support, from a large hospital system or a large clinic with a lot of fancy machines, because we're able to get the same thing, if not more so, by being working on these things in their home environment. And the downside to the machines is you also, in order for the body to recover in the way that the machine is intended to, a lot of times you need, let's say a body weight support treadmill system, for instance, great tool in the toolbox, great machine, and has a lot of benefits. The downside is how many repetitions are you really going to get with that type of machine? How much access are you going to have? How much scheduling do you have to do with other people who are also wanting to get on the machine? How long are you going to be able to go to that rehab facility and get on the machine to get the amount of repetitions that the nervous system requires in order to get the benefits that is intended? And so there's a lot of downsides when you're looking at something that is very expensive and there's not a whole lot of them. And there's a lot of people that want to be able to use them. There's a lot of downsides versus having phenomenal clinicians, being able to work with people in their home environment. If it's a doctor going out to you and, just that one-on-one focus in the home environment. And there's lots of other mobile options as well, mobile labs and mobile imaging. There's all sorts of things that is available to us now where, again, kind of breaking the paradigm. In healthcare, there's lots of opportunity for healthcare providers to get out to people and see them in whatever environment they're in, if it's assisted living or in the house or the home or their place of business. We work with people in their place of business at times, or sometimes it's being able to walk into their place of business, and we've done that in the past, or into a shopping environment. And so for the healthcare provider to be able to work with them in their real environment in real time is a significant advantage, and often it's the basics, right? It's the details that we're able to see in this sort of a situation, and our clients experience that every day. Another benefit to the different healthcare models that we're seeing today is a new relationship between the patient and the healthcare provider, or what was, formerly the patient and the healthcare provider. And it's a similar difference between the customer versus the client. And here's kind of the difference. Let's say you have an attorney who, when you're in your 30s and 40s, helps you with your will. Have a couple kids, you need a will. As things become more complicated, you start thinking about estate planning. And of course, your kids get older and you start saving up for college, and you put all these different savings in place. You put all these legal things into place that protect you and your family in the event that something happens. And that attorney stays with you over the long haul, to the point where even your children have somewhat of a relationship with them. They know the attorney, they're familiar with them, And so when the time comes when the attorney and their associates have need to work with the family, let's say when something happens with the parents, the children already know the attorneys, right? And they're already familiar with what's going on. And there's that trust there. There's that rapport there. The attorney is working with the family on a fiduciary basis. They're looking out for the family. They're not beholden to anything else, not a hospital system, not another company. We're looking out for the family. That's the most important thing. And again, it's that fiduciary relationship. And it tends to be a longer term relationship. It's built on years and years of trust. That's a client relationship as opposed to a customer relationship. Let's say if you go to an attorney and you just get your will done real quick, and then that's it. Or you go and form an LLC for a business, and then that's all it's done. It's a customer relationship. That client relationship is over the long term, built on trust, built on years of collaboration, problem solving along the way. That sort of relationship is the type of thing we're seeing in healthcare now, and that's exciting. We're seeing that with physicians and the medical model, whether they're concierge doctors or direct pay doctors, and we're seeing that in other parts of healthcare as well. And so people are working with healthcare providers over the long term, and in a way that's built on trust and problem solving and guidance. And the healthcare provider is there for them. They're not needing to respond to a large hospital system. They're not needing to respond to anything else other than their clients. And I think that's important right now as well. And I think in today's environment, we need a lot more of that. So what we're able to do is provide more of a client-based relationship as opposed to a customer-based relationship. And, there's a lot of exciting things with that. So,
Hey everybody, this is the producer, Anmar here. If you enjoyed this episode, please leave us a review. If you want to subscribe to the Optimove podcast, head to www.podcast.optimovedfw.com. That's where you'll find links to subscribe on Spotify, Apple Podcasts, or wherever you listen to podcasts. Once again, that's www.podcast.optimovedfw.com. To learn more about Optimove, our practice, go to www.optimovedfw.com. And lastly, if you're in the Dallas-Fort Worth area, give us a call at 214-712-8242. That's 214-712-8242. Thanks for listening, and we'll catch you in the next episode.